What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today, I have a very special guest with us, Dr. Kristen Sparrow. She's a medical doctor, acupuncturist. She's board certified in anesthesiology and pediatrics, and now she does clinical acupuncture. Welcome to the show, Dr. Sparrow.
Thank you very much, and thank you for having me. It'll be fun.
Absolutely. So tell us a little bit about your migration from allopathic medicine. So you finished your residency, and then did you go into private practice?
Yeah, so I worked in San Francisco in private practice. Well, not private practice. Well, I was at Kaiser, and I was
Gotcha.
at Kaiser for about 11 years, and then contracted a pretty severe latex allergy, which is in latex is in all the gloves. So unfortunately, because of that allergy, because can become very serious, I had to take a leave of absence. And during that time, my husband and we had 3 kids, decided to take an actual like sabbatical, and we moved to Spain. And in that time, when I first got there, I started to want a project, so I started learning acupuncture. And in the course of my studies, I also received acupuncture for my allergies. And I had a very remarkable experience, and it basically cured me of my allergies. I mean, not 100%, but really remarkable results. And so the what happened was my leave of absence then was extended because the hospitals didn't get rid of latex for years. It took years for them to get rid of the latex. So in the interim, I ended up going into practice in acupuncture. And that's what I've been doing ever since. And because of I was a biochemist before I went to medical school. And then because of anesthesiology and pediatrics, I just have been following the science behind acupuncture ever since I started. And so
The
that
actual
is
science, not the
the
dogma,
actual,
right?
yeah, because I really wanted to know how how this worked. When I was taking my acupuncture training, the only sort of scientific model that they had for acupuncture was something called gating. And what gating is that if you occupy a nerve ending with, say, vibration or touch, that occupies the nerve ending so that the pain signals don't reach the brain. And so that was the operative model for how acupuncture worked. But since then, in the interim, 2 decades, we have many more mechanisms how it works. Because what interested me is that I had had this personal experience, having had it cure my allergies. And I can go into the experience maybe later or now, whichever
Yeah.
you prefer, but it didn't make sense to me. I mean, this had nothing to do with gating.
Right.
Something changed in my immunology and my physiology that I couldn't explain.
Does
And
it
so that's
modulate the
really,
Th1, Th2 response?
I don't know. What do
The
you
T
mean?
helper 1, T helper 2, T helper 17?
Well, I mean, now we can look at those things. Now we
But
can
back
look at
then you
those things,
didn't.
but that then we didn't. And so what interested me was just a chance. I listened to Robert Sapolsky. Now that'll date how long ago this was. Robert Sapolsky is a professor at Stanford, and he
Why
wrote
zebras don't
this
get ulcers.
exactly. And so I heard him give a talk on that book. And I just thought, maybe this is the key because he talks about how stress can have all these other effects on the body and how animals don't have this outsized stress response because if they have a fright or flight, some incident, they kind of get over it. Whereas adults, humans with our oversized brains, we keep those stress is going and anticipation and dread and so we have this low grade or high grade in some cases um, stress response, and so
Right.
that's why zebras don't get ulcers and we do. And so that, because I was an anesthesiologist and I was always looking for monitors, because that's what we did all day, was monitor physiological changes in patients undergoing anesthesia. I thought, well, maybe there's some monitor for this. And so I did some research and found HRV. This was, again, a long time ago. So it wasn't very commonly used back then. And I started presenting at conferences using HRV in conjunction with acupuncture. And so now that is sort of almost part of the whole understanding of acupuncture. I mean, I'm not saying I caused it, but I was very
Right.
early to that insight.
And what do you think, looking back now that we have more research, what do you think some of the mechanisms were in terms of modulating the immune response?
It's a I'll try to give a short answer. Um, what happens when you increase parasympathetic activity? So there's sympathetic activity, which is fight or flight, and your adrenaline going, and that is life-saving. That can be life-saving, and it's a very important reflex in our bodies and in animals also. But then the balancing arm is called the parasympathetic activity, and that is rest, digest, and reproduction, and that is the opposite. So if you increase your parasympathetic activity, that increases your healing response. Now, how that modulates immune function is that by doing a slight little injury, which is what acupuncture is, it triggers message to the brain and back that modulates the healing response. I know that sounds kind of crazy, but if you have what I had, which was allergy, what that is a response to an allergen, which is outsized and destructive. So if you modulate that with acupuncture, it stimulates your parasympathetic activity, which then quells the immune response. It's through certain cytokines, et cetera. So that's what we know now. And now we have a lot of research that parasympathetic activity is very tightly correlated with inflammation. And of course, inflammation is part of all the big killers: cardiovascular disease, cancer, Alzheimer's, etc. So we see now we can kind of explain the ancient teachings about how you stay well by becoming balanced. And so balanced has a lot of different meanings in Chinese medicine, but one great metaphor is the autonomic nervous system.
Yeah, and we're talking about the Hulis device that I use,
Yes. Mm-hmm.
which is obviously not acupuncture, but it stimulates the vagus nerve and that activates the anti-inflammatory reflex. So you get decreased cytokine activity. And if you decrease inflammation, you're going to increase detoxification. So it's just
Yes.
snowballing in a positive manner.
Yeah. Yeah. I know you're very interested in the detoxification, and I think that is looked at. I mean, it fits with acupuncture, but it's kind of it's part and parcel of it also. I know in your
Right.
book you talk about that a lot. There
Yeah.
was a recent study. So what I've been using in the clinic in conjunction with acupuncture is something called transcutaneous auricular vagal nerve stim, and it's very simple to do. You can just put a clip on the ear with a TENS device, as you say. The 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 frequency varies what they think works best. At this point in time, they say 25 hertz. There was a recent study that I don't know, I found this remarkable. They did a study on people with knee pain, osteoarthritis, knee pain, and they put the device on for an entire hour, and they did it once. They just did 1 hour, and that 1 hour had significant effect on their knee pain. And I guess what was surprising to me is, one, that it was an hour. I'd never done that before. Usually it's 20 minutes, 30
Yeah.
minutes. And two, that they would choose that patient population and that it was so effective. So I think we're really making some great progress
Yeah.
on
And
using these devices. The thing I love about the TAVNS, the transcutaneous auricular vagal nerve stim, in patients who are willing to get it, excuse me, is that it's something that is inexpensive and you can do it at home.
right.
And I think that acupuncture is very potent, but this is a great way to consolidate treatment, extend treatment, et cetera.
I was reading an article, I think last week, about acupuncture treating someone's lateral epicondylitis. And so,
What were
generally
they treating? I'm sorry.
lateral, so tennis elbow,
Oh,
lateral
tennis, yeah.
epicondylitis. And, normally, well, at least I didn't think of acupuncture as treating musculoskeletal, like as in, joint manipulation and stuff. But apparently they're expanding, and depending on your training, you can treat musculoskeletal conditions. It
Sure.
can be helpful
Oh,
for that.
absolutely. Because if you think about it, what does it do? When you have especially like a tendon, it doesn't
Right.
get much it doesn't get much circulation.
Perfusion.
So what happens is the body kind of walls it off and just leaves it
Mhm.
alone. So if you treat, it's dry needling. Some physical therapists use needling, and acupuncture is similar, only it's not, the needles are smaller and it's a little more refined where you put it, but that awakens the body to the fact that there's a problem there. And so you get it in the short term. Sometimes it's not uncommon at all. I'd say 33% of people, it hurts more. And sometimes it'll even get swollen, but that's good because then what happens is the body takes care of it. And so, yeah, low back, same thing. Lots of musculoskeletal things. Shoulders are tricky, but it can work for shoulders. But it's trickier because of all the different parts.
Yeah. Yeah. I also heard of facial acupuncture so it's a safe alternative to Botox and filler. Are you familiar
Yeah.
with that?
Yeah, I do. I have
You
several
do.
patients who have that. It's kind of a whole kind of more comprehensive. You end up doing body acupuncture, which is always for the best because that helps their healing response. And then there's scalp needles and then some needles strategically placed in the face. And then you use small, tiny subcutaneous needles in individual wrinkles. And I've had, or I have patients who've been coming for years because it helps stave off the inevitable, the inevitable nature. So.
Does it stimulate, or is there any evidence saying that it stimulates collagen or elastin production?
Yeah, yeah. There's definitely, it's good for collagen production. I also use microneedling, but I do just, low tech. You can buy just manual, it's like a little roller with little tiny needles on it. I use that myself and I recommend it to patients too,
Is that kind of
because
like a
it
derma roller?
definitely stimulates collagen. Mm.
It's kind of like a derma roller.
It's called a derma roller, and
Okay.
people do microneedling in the clinic, but I do think the derma roller, I've over the years I've kind of changed. I don't think you need deep stimulation with the derma roller. I think just a fine roller on the face does a lot. And when you use a heavier duty, thicker one, sometimes you can run into problems and I don't think you get any better results. So that's my quick take on facial acupuncture.
And acupuncture school, I think it's what, like 4 years, 5 years, something like
I
that.
did I did 3 years, but that was in Spain. I studied in Spain. So
Okay.
it was, a different routine.
But you were still
I went
allowed to get certified here.
Well, the thing is in California where I practice, if you are an MD, you are licensed to do
Okay.
acupuncture. Yeah.
Okay.
Which I don't
Awesome.
know. I have my quibbles with that. I don't know. But most doctors, they want to know what they're doing. I mean, I think
Right.
they rely on that and their safety first. And it's kind of in your DNA to
Right.
to be to be safe and not do anything crazy. So I,
Yeah.
I think I agree with that policy. I think if
Yeah.
you've done enough training to do medicine, I think you'll be safe doing acupuncture.
Yeah, I mean, the only, I hear about people, like I have a colleague who has three doctorates. He's a DO, a naturopath, and a chiropractor.
Oh,
And
wow.
every time he went to get another doctorate, the second and the third doctorate, he had to repeat even gross anatomy. The origin and insertion of latissimus dorsi doesn't change. The only people benefiting from that were the schools making.
They waived that for me when I got
Oh,
my
they
trip
did.
in Spain. I didn't have to do any of that. And
Oh,
that
that's
makes
good.
little sense to me.
Yeah. I mean, it's just, I know, for example, in the UK, if you're a doctorate level healthcare provider, you can go for an additional year and not prescribe everything, but some common basic medications. That way, people have more access.
Oh, so
Um,
nurse practitioner almost kind of thing, or yeah.
yeah, basically. Yeah.
Yeah.
Which makes
Health
sense versus,
extenders, which, yeah, absolutely. That's what we need. We need more of that.
yeah, exactly. So how did you get, when you started into acupuncture, did you start just general acupuncture or did you go right into the type that you're doing now?
I still do general acupuncture, I would
Oh, you still
say.
do.
Oh, yeah. Yeah. I mean, I have my specialties, which I would say most of my patients are migraine, allergy, and menopause, but I do a lot of pain. I
Right.
do this. That's usually what people think of. But some of my most interesting and remarkable sort of, you know, paradigm changing cases were things that you wouldn't expect. For example, panic attacks. I mean, one of my patients was a patient with panic attacks, and she was in her 30s, fun, athletic. She had three little kids. But she had these disabling panic attacks whenever she had to go on a bridge, which in the Bay Area is not infrequent. And I gave her I had done 3 sessions and I just had started using my HRV machine. And
Okay.
what I saw was that on needling her, she spiked in her stress, which is no surprise. And then it went down below baseline. And every time it did exactly the same thing, it was almost like a footprint or a fingerprint. I could recognize her tracing. And within 3 treatments, she was a lot better. And over time, her HRV actually improved also. And so I was able to write up some of these observations. This was back in the old days, and it was published. And then soon after that, there was a doctor out of Germany who also noticed this, that if patients, you see this decrease in their stress response with acupuncture, they're more likely to respond because there are non-responders in acupuncture. And so that was a key insight. And so the question is, if people don't respond, what if you treated them different? What if you treated them more often? What if you use different stimulation? There's it opens up a whole new way of trying to evaluate treatment and improving treatment, which is what I'm all about
Yeah.
in general. Just all
Right.
these, it's what I think the tragedy of the man is machine model. I go into that a lot in my book, Radical Resilience. The problem with using that model exclusively, even though it's brought us so many great things, transplants and infusions and so many, and, medications, it limits the research, and it limits how people think about how their body works. And so it can be stifling. And I think so what I try to introduce is this new way of looking at the body, and how if you stimulate it, we are a system of feedback machines. We're feedback loops. And so you prod one and then it improves and then it helps the others improve. And now with systems biology, which is a whole new, you know, area of research, field of research, we have reason to understand why the body is part of nature and it reacts as nature does, which is in cascades of response and feedback loops, not necessarily as levers and cogs and so on.
Right.
So,
And I know last time we talked about, like you said, using the machine to measure HRV, but that's
mhm.
not a typical, from the acupuncturist I know, which admittedly is not a lot. They say, they think about more chi in terms of energy flow.
Mhm.
but you kind of describe it in terms more of the autonomic nervous system. So are there a lot of acupuncturists who do what you do?
I don't think so. I think it's pretty much my own thing, and I don't want to be arrogant and say that the chi and all that old teaching it isn't worthwhile, because I do pulse analysis and look at the tongue and get those kind of data points. However, I do feel like we're in an evidence-based society, and I think for some people it's very helpful. They really like to know what's going on with their HRV, because there's more and more, it helps bridge this gap,
Right.
that I think, because HRV is now, you can look at trends, and people when their HRV improves, their sense of well-being improves. Now that was always unmeasurable. That was always just this kind of vague concept. Well, it's not
Right.
anymore. We can measure the HRV, and it also shows that if your HRV is improved, you are less likely to get non-communicable diseases. What are those? Those are the ones like hypertension. Communicable diseases are, viruses and bacteria and COVID and those. But if, diabetes and high blood pressure and those other kinds of just chronic diseases, which we are plagued with, those improve, and you're less likely to get those if your HRV is good. And that makes total sense, because it is the number one thing that you can do for yourself, is improving HRV. And as you talk about in your book, it's breathing, but it's also exercise. And acupuncture is a huge biohack. I think that's overlooked because it's so good for that. But paying attention to these levers, these big levers of our health, sleep, exercise, those are, and then of course the devices, I'm all for them.
Right.
I think it's great. If people reach for that instead of for a Valium, oh man, that's our work is 90% done.
Right. Exactly. I had a guy named Dr. Torkel Farrow, who's an ER doctor, still practicing um,
Where
in
does he work?
Norway. In Norway.
Oh, nice.
Um,
Yeah,
and
that name.
so
Okay, makes sense.
Yeah, he said, when he started, he would be like on shift and, it would be like slight downtime and he would have like a 12 lead EKG on himself. And, he's doing different things to see his heart rate variability and see if there's any abnormalities in the T wave, ST segment elevation, all that stuff. And people just thought he was like a strange guy. And now, he's already working on the second book because the first one was such a hit, which, I see quite a few ER doctors transitioning into functional medicine. I think from what I'm told when I ask them why, they say, oh, well, it's a young person's game and they're tired of taking call. And then I've also heard them say that, they've had a few run-ins where they get close to get stuck with a needle, from someone who's, infected
Ah,
or
yeah.
someone who's on, illicit drugs and they might try to stab them or whatever. And it sounds crazy, but if you're at a level one trauma center, it's fairly common,
Yeah,
unfortunately.
that was part of my
Um,
training. Absolutely.
yeah. So
Yeah.
I think more and more because it's easy to be closed off to something until you have an issue or a loved one has an issue and allopathic medicine can't solve it. I mean, when I had kidney stones, I was not interested in a glutathione push or vagus nerve stimulation. I'm like, give me the good stuff, because I
The
thought I was
real
having a
stuff.
baby.
I mean, I think
Yeah.
that's the thing, is people say, no, 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 this is serious. No, I need real medicine. And
Yeah.
it's a, it's all risk benefit, right? I mean,
Right.
it sometimes absolutely you need your appendix out, or you need to fix your leg, or
Right.
of course. I mean, you don't throw out the baby with the bathwater. However, in my book, I have the story of a baseball player, pro baseball player, who had horrible back pain. He ended up with a vagal nerve stimulation, not vagal nerves, I'm sorry, spinal cord stimulation. The battery migrated, it burned his lungs. I mean, it is a really horrendous story. And I use that story just to point out all the things that can go wrong, all the
Right.
things that, if he instead, if we could think about, like in Germany, for example, they pay for people to go to health spas. You know, if he could, and pain is tough because when people are in pain, it's very serious, you know, to them, and everybody's panic stricken, and I totally get it. But again, that's almost the time you need to really be careful because things can, you know, because of the desperation, the decisions can lead to problems for sure.
Absolutely. And, like in Germany, I know, I think it's still applicable, but if you have coronary artery disease, before they will approve bypass surgery, you have to receive, I think it's 33 IV chelation treatments. And in general, that cures
I'm
85%
sorry, say what's the treatment?
IV chelation. So like
Oh,
IV
interesting.
EDTA
Huh, uh-huh,
or, clearing the coronary arteries. There's a good book called Bypassing Bypass Surgery written by a Harvard
uh-huh.
trained MD. I have it somewhere. But they know that that's going to help 80 to 85% of cases. And
They're
then the ones who
they're
don't,
they're more forward thinking in Germany. I
yeah,
mean, they were doing their insurance companies were doing acupuncture research studies 20 years ago to see if
yeah,
they were worthwhile, and they found yes, they are worthwhile. They save
right,
us money, they help the patients, and you know, we don't do that here. I mean, you know, it's just
right.
not. And now the way things are going, I mean, the funding is less and less. We're very lucky in acupuncture in that there's really good research coming out of China, and they believe in it and they fund it, and we benefit from that. You have to still take all the research, and we need to redo the studies, but gosh, that happens here too. I mean, in any kind of study,
Yeah.
it needs to be repeated, and we don't have the funds or the willingness to do it. But anyway, in acupuncture, we've gotten a lot of good research out of China. The individual messengers, the actual results, the comparison groups, they get these huge
Right.
population studies. So,
I know a lot of the research on molecular hydrogen was done in Asian countries, for example, Japan. Now we're starting to get some research and we have, a lot more than we did, but the initial research was done in those countries and we benefited from it because I remember only 6, 7 years ago, people would say, oh, molecular hydrogen, there's no research on that. I'm like, no, you haven't read the research on that, but that doesn't mean it doesn't exist.
no, it's so true. I mean, there's sort of a bias that way.
Yeah,
If I haven't read it, it isn't real.
right,
And that's why I wrote my book, just to try to raise consciousness a little bit. No, there's science here. There's some science
right.
here, you know.
Absolutely.
What is your routine? What do you have a daily routine, or or do you always experiment, or how does
So
that work?
I do red light therapy, a 3/4 body panel from an
Okay.
EMR tech. I typically do that in the mornings for 25 to 30 minutes. And I do some breath work while I'm
And
doing
is it
that.
whole, it's a whole screen? So you do.
So it's about that long. So yeah, about that long, about that wide, and it's red, near infrared. It's pretty powerful. Now they have one, I don't have this one, but they have it where they combine red, near infrared, and UVA and UVB. For example, for people in Canada who or other cold
Uh-huh.
climates.
Who need,
But I'll go out and get morning sun for 20 to 30 minutes. I'll come in and do red light therapy and some breath work. Then, I'll start my day. And then while I'm working, I'll usually breathe some molecular hydrogen.
so you
And
do
then
the hydrogen every day.
I would say 6 days a week, 5 or 6 days
Okay.
a week.
Okay.
Yeah. I've breathed it for up to 6 hours before. There's really no upper toxicity limit. The only thing is when you're increasing cellular ATP, your cells will start to dump toxins. So if someone's really toxic, they haven't done it before, you don't want to start with, 45 minutes. You want to start with 10 or 20 and, go from there. And then in the evenings, I have a walking pad. If I didn't go to the gym that day, I'll walk in the walking pad, which I don't know if you've seen those. You can get one for like $170. It's essentially a treadmill without the motherboard in the front and it's light, so you can roll it from room to room. And it's
Yep.
just a way for me to get
I
my
have
steps
one in
in.
a box. I
Oh, you
haven't
have
got
it.
it. I got it before Christmas even, and I have about to. But
Yeah.
I've been at I usually am outside. So
Yeah. I prefer to get outside here with the
yeah.
humidity.
But it's a
Uh,
great option.
yeah.
Absolutely.
So I'll do that and then vibration plate for 5 to 10 minutes to get the lymphatic system moving. I have a sauna upstairs. I do that probably twice a week, not as much as I should, but at the end of the
Is
day,
it an infrared or is it a
it's a
traditional?
near, mid, and far infrared. It's the Therasage. It's the portable one that you sit in, comes up
Yeah,
to
you sit
here.
in, so your head isn't in it, right?
Right.
Yeah.
And it has red light panels in it, but I didn't really care about that because I have the separate red light panel. Um, but it used to be the case that portable saunas weren't powerful enough to elicit a response. But now, like with Therasage, I think I paid like 1,400 for mine 4 or 5 years ago,
Hmm.
which is really good.
Yeah.
Now it's not as powerful as the $10,000 ones that you have to put together and have sound frequencies, but I want to be able to carry mine with me if I travel. Um, have I don't do these that often, but a lumen photon device.
So I back up a second. So you can take this sauna with you.
Yeah, it has a bag. It's so
Oh, that's
lightweight, holds
amazing.
up.
Wow.
Yeah.
Okay.
And then I
And
have
do you
a,
sweat? I mean, how does that
oh
work?
yeah, it's got like crazy. It goes up to 170 degrees Fahrenheit.
Uh-huh.
So I'll plug it in for about 15 minutes, 10 to 15 minutes before I get in. Yeah, I have a towel in there and I mean, I'm
I do
drenched.
old school. I go to the Y and get in the sauna. I just do old
Okay.
school.
Is it infrared or just regular heat
Oh,
sauna?
it's just old school,
Okay.
heater. You sit on a bench, all that stuff.
Yeah.
Other people are in there. All that.
Yeah.
I
And
just,
so I've heard that, with infrared saunas, you don't want to share it with someone else because you are expelling toxins through the
yeah,
lungs.
yeah, I can imagine. Yeah. But in
So,
the old school ones, it's so hot. I mean,
right.
anyway, but I kind of like having the thought of having my head out of the sauna because I feel like I'm getting benefit from my head being in there, but who knows? We need to
Yeah.
study all these things.
Well, I mean, yeah, the clear light, some lighting is good. Clear light is probably the gold standard in my opinion. And they have one that I think it's like 10 or 12 grand. It has sound therapy. It has, I think, PMF in it, if I'm not mistaken. But, it's also going to take up probably half this room.
Yeah.
Um, and so it's risk benefit. I mean, Dr. Rhonda Patrick at University of Southern California,
Yeah, I
she's,
follow her. Yeah.
yeah, so
She's she was one of the big proponents early on of sauna. Yeah.
I heard her talking about a study. I don't know when it came out, but they said if you do 30 minutes 4 times a week at 170 to 180 degrees Fahrenheit, your risk of all-cause mortality goes
Well,
down
cause
by roughly
mortality. Yeah.
40%,
Yeah. I
which
know.
there's
I
no
think it's
medication.
5 times. I actually do think it's 5 times a week, but I mean, same idea. I mean, the
Yeah,
more you do, the better. And it is all cause mortality. It was a Finnish study. I put that in the
yeah.
book too.
I know she said if you go up to 7 times per week, that it goes up to 50% reduction.
Yeah. It is dosage. It's
Yeah.
amazing.
And
I
the
don't,
frequency
I try,
trumps the duration.
I try to get it, but again, since I'm going to the Y, it's not at my house. And I do feel like that's an investment I should make is put in a sauna in my house, but
Right.
haven't done it yet.
And then I have a mini Therasage PEMF mat with infrared and has the amethyst crystals. It's only about that long, so it'll go from like here down to upper thighs. I just wanted something again I could take with me when I travel. I do that probably 3 to 4 times per week, but that definitely helps. If you can do that first before you do the other therapies, kind of primes the cells to receive the therapies. The concept is, you're changing the voltage, and so the cell membranes are functioning better. And that's why if you look at like Gary Brecka, well, he left the 10 times health system, but Grant Cardone, that 10 times health system, they have the three main therapies and PMF they do first, and they do EWAT, exercise with oxygen therapy, then they do the red light therapy. So
And
you're priming the cells to receive the
and
oxygen,
how do
and then
what are they measuring as an outcome?
they have a genetic test that they do, and I think they have some epigenetic clock testings that they do,
Oh,
but
okay.
it's more just like biohacking centers.
Uh-huh.
I'm sure it's more involved in that, but that's what they're kind of known for is, the three therapies, those three primary therapies that people
Okay.
go to, and people will invest in franchising it in different areas of the country.
I see. Yeah.
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 But so if someone comes to you with, let's say, shoulder pain or lumbar spine pain, do you do general, like a localized treatment?
Yeah. Because
You do.
I do think shoulder's tricky, like I say. I mean, that's a different because you definitely need remote points. You definitely need leg points because you really need to activate everything because the shoulder is just tricky to get the right exact tendon. So you do your best to figure out which insertions and muscle is involved, and you do
Mhm.
local needling. But then I always do general parasympathetic enhancing treatment, which is certain points that are in certain places. And I do that almost on everyone because you want to encourage healing. We're
Right.
trying to increase the healing energy. So yes, with back pain, with ankle pain, shoulder pain, any of those. Migraine is a little different. Migraine, because it's not a musculoskeletal problem per
Right.
se. It can be triggered by musculoskeletal stuff. You do lots of remote points. You do lots of hand, feet, because you're really trying to desensitize the system to noxious stimuli. Because the thing that happens in migraine, and this is simplifying, and it isn't for everything, for everyone and every time, but my migraine success is quite good. And how I see it happening is that people with migraine are very sensitive. They're sensitive, or they can be, to light, smells, if they slept poorly, if they had a glass of wine, all those things can just trigger them and off they go. And by doing the acupuncture, you make their system more resilient. I think it's the whole point of my book, The Radical Resilience. That's what I think a lot of times acupuncture is doing. And you really see it with migraines. For example, I've had a number of patients who have aura. They'll have an aura before their migraines. And what happens as treatment goes along is they often will still get an aura, but it doesn't trigger, it doesn't go, it doesn't flood the head. They don't get the pain. And that's what's disabling. The aura is disturbing to them, of course, because it shows that they still have that weakness. It hasn't gone away, but it doesn't go into the disabling migraine. So that's kind of how I see migraine, for example, which is a different kind of pain. And
And do you treat, or I know some MDs who refer to acupuncturists for fertility and couples who
mhm,
are trying to conceive. I know
mhm.
that's totally different than treating an orthopedic condition, but do you do that at
It's
all?
sort of the same, we see that IVF, I mean that fertility is also, I mean, I hate to have one answer for everything, but you treat traditionally for the reproductive system and the points that can regulate the reproductive system, but then definitely you want to decrease stress
Right.
because it's clear from anecdotal evidence and that, I mean, it seems obvious, I think, to people, right? That
Yeah.
if you relax them and get them not to be so hyper about it, it helps. It
Yeah.
helps.
You
So
can't,
that's,
I tell my male patients, you can't have an erection when you're running from a tiger,
yeah.
you know?
No,
And
very
then
much,
point
yeah.
being, when you're stressed, that's when the pregnenolone steal and progesterone steal happen. So body's going to always
And
prioritize.
you aren't in that relaxed state. You're not
Right.
in the reproductive, and the irony is that for longevity, at the cellular level, you kind of want some scarcity. And so there are certain cellular mechanisms, AMPK, the
Yeah.
sirtuin system, mTOR, they're triggered by scarcity. So that you want you don't want you want your cells to feel like, okay, we have to hunker down now. And then in doing that, they start cleaning themselves. And that, they use up all the protein discarded, parts of
Right.
the protein that are in the cell, and that
Mm.
leads to longevity. Um, and so acupuncture triggers all those three also, all those uh, those
Wow, I
mechanisms.
didn't know that.
And
Yeah,
yeah,
so
yeah.
we talk about those all the time, in terms of biohacking, functional medicine type stuff, but I didn't, you're the first acupuncturist I've heard talk about
Yeah,
that.
well, the interesting thing is the way I put it together in the book is that so I'll just quickly go through sort of the one of the structures of the
Mhm.
book I wrote is that what really caught my attention when I was doing acupuncture training was they had this kind of legend about the three types of doctors in the old days. Doctor number one was this incredible healer. His waiting room was full. Everybody wanted to see him. Why? And I say him because they were all men back then. And why? Well, because they could see that he kept the patients well. He would give them herbs and he would give them acupuncture and he would, say, take a walk for blah, blah, blah. He would give lifestyle advice. And they saw that it helped and that other people were getting sick. They weren't. So that was doctor number one. He kept his patients well. Doctor number two could help you if you were sick. He could give you medication, treatment, and put a cast on, etc. But he didn't keep you well. So he was in business, but he wasn't famous like Doctor One because that wasn't what he did. And then Doctor Three made patients worse, and he was only seen under dire circumstances. So
Right.
that always stuck with me because in traditional Western medicine, we don't have that concept of that there, of staying well, of because our prevention isn't like something you do to your body, it's by testing to make sure nothing's wrong. And so how did Dr. One do that? Well, number one, he looked for balance. And so if you remain balanced, and so that's a complicated algorithm in Chinese medicine, but a good metaphor is the autonomic nervous system.
Homeostasis, essentially, right?
Right, well, also a lot of systems in our body have homeostasis and they all then feed on each other. But
Right.
the other thing is he would implement a type of hormesis, right? Because if you can say do no harm, which was a big part of what Dr. One would advocate, getting rid of harmful habits, that kind of thing. I would include taking unnecessary medications in that calculation. But you can't just sit in your room. You may be avoiding harm, but that obviously you deteriorate very quickly. So the second step is hormesis. And what is hormesis? It's that gentle challenge to your system. Exercise, those kinds of things. Exercise is the perfect example where you do small challenges to your system, and over time you get more and more strong. Acupuncture is also a type of hormetic, which I saw with my allergies, because what I had was some slight increase and improvement in my symptoms, and then suddenly I had a crisis of cure where my allergies were gone. And so that's kind of what we kind of like to go for in acupuncture, where you can see gradual, and then sometimes a big quantum leap forward in your mood and your health, etc. And then the final part of what Dr. One would acknowledge is that all the systems go together. So you talk about gut health all the time in your book, and that is a perfect example. Like, if you can get the gut better, or your sleep is a big focus in my practice, to do all kinds of things to help people sleep. They're levers. Those are big time levers for health. And so all those things go together. And now we can study those with systems biology, how these systems all work together. And so you can get in a virtuous cycle where they're all going forward. And, then you can sometimes get really remarkable improvements. They can also go the wrong way. And I feel like a lot of the things that we counsel against, certain foods for certain people, and medications are among those. It's kind of like throwing sand in the works. I mean, like, you can keep going, but it's not as is smooth and frictionless. So you want to try to get rid of things that are impeding you as much as you can.
And what would you say, like the most remarkable case study you have to date that comes to the forefront of your mind is?
Well, my own personal one, I would say, was quite remarkable because what happened was, so I was in my second session of treatment. So I had had 10 sessions and then I was in the second, series of 10 treatments. And it was about three sessions into that. And I had noticed a little improvement, but nothing drastic. And then that night, I was home reading to my daughter, and I had this huge allergy attack. It was worse than anything I'd ever had. I was just sneezing, and my eyes were watering, and my throat was closing, and all this. It was quite drastic, and it just came out of the blue. And so I chose. I stepped back from my Western mind and decided to just go with it. And I didn't go to the doctor. I didn't go to the emergency room. I just got in the shower, washed off, and it subsided. I had a treatment the next day, and I went and I had sunglasses on. I mean, I was a wreck. I looked really bad. And my acupuncturist said, "You have gotten rid of the perversive energy. It is gone now." And I didn't believe him. I thought, no, I just had an allergy, but he was right. I never really had allergies again. So that is an example of what and it's happened. Sometimes it happens early in a treatment. For me, it was 13 treatments or something. But for some people, like the panic attack case, that was really remarkable to me. I mean, within 3 treatments, she wasn't getting triggered anymore. So that case, another really interesting one was I had a guy who, in his 50s, had severe back pain. They were going to do surgery on him. And he came to me really as a last ditch to try to avoid surgery. And it turns out he was really, really, I still see him from time to time, very, very sensitive to needles. So I had to use tiny, tiny needles, barely could, give him his treatment with a really sensitive guy. But he was better. He was better within 3 or 4 treatments, even though he was so sensitive. And maybe was it because he was sensitive? And he's been fine ever since. He does come occasionally, it'll tweak and he'll come back in. But it's just those kind of cases, it's remarkable to me, especially somebody who can't stand heavy needling and just
Right.
light needling. It's just like all the ancient teachings say. So I have a lot of respect for, I think a lot of the teachings that we have, they may not stand the test of time, but some do. And I think we may find out why with ongoing science and ongoing trying to find out what are the things that really make it work well, efficiently, and quickly. And sometimes the body is just going to be, it's part of nature. You can't push it. It's like stretching. It's like therapy. We all want it to work immediately, but that can get you into trouble. And if people can recognize small changes with the treatments, then and be encouraged, that is the best. And stay off medications if they can, frankly.
Absolutely. So do you have people, if they come in for an acute injury and say they need 8 sessions, do you have them come like once a month or once every 6 weeks on a maintenance program?
It really depends, and it depends on the patient too. I have a lot of people who just come in every week. I mean, they're not the majority, but I do have a sort of a segment because they just can tell they feel better. And if they don't come in, they're on vacation or they haven't come in for a while for whatever reason, they can tell the difference. And so they just come in. It's just part of their routine. They usually have something. Oh, my digestion's off, or I didn't sleep well, or I had a migraine, or whatever it is. I mean, they might have something that I need to address, but they clearly just see the benefit and they can tell
Right.
the difference if they don't come in. So
What's
it really depends on the people, because some people that, of course, that just doesn't fit into their life or
yeah,
whatever it is, and that's perfectly, fine. But I
sure.
do think the real benefit comes if you can keep it up. for sure.
And what's something that you know today that you wish you would have known 10 to 12 years ago?
I know you asked me that in the questionnaire, and I come up, I, I don't know. I guess it's hard to remember what I didn't know then. I think one thing was when maybe, I don't know, maybe this is, oh, maybe this would qualify. I was very skeptical of Chinese research when I first started. I wouldn't even read it. I just didn't trust it. Their results were too good. And that has changed. That has changed. And it changed with my ongoing interest in acupuncture research and going to the conferences and seeing the level of rigor increasing over the years. And so I kind of regret that. But I think it shows that they really have taken it more seriously and they don't just publish 95% results because, you can't, that's obviously not true. So,
Well, awesome. Thank you so much for the work that you're doing. Where can folks find you?
sure. Um, on my website, it's ksparrowmd.com. And I
Okay.
have a YouTube station with the same handle, and I have my book, linked to my books there. And yeah, I guess I would like to say to people, please take your stress seriously. Do whatever little things you can because it's such a Archimedes lever for everything, and you'll be happy you did. So it doesn't have to be acupuncture, but breathing, exercise, it's
Thank you
huge.
so much for what you're
Okay.
doing. And hopefully we can have you back on in the future. And hopefully this episode comes out well.
Yeah. Yeah. Hopefully it was recorded. Okay,
All
thanks.
right.
Thanks for
Thank you,
having
Dr.
me. I really
Sparrow.
appreciate it. Very, very interesting. Bye.
Have a great day.